So I was really surprised when she said it came back as melanoma, because what I knew about melanoma at the time was just how deadly.
An annual diagnosis of skin cancer sends chills down the spines of millions. It is the most frequent cancer in the U.S., with over 5 million cases diagnosed every year. Although a lot of us try to keep our skin safe, the truth is that nobody is completely protected. Evening news host and respected journalist Norah O'Donnell of CBS understands this to be true. O'Donnell recently revealed her personal terrifying experience with melanoma, the most deadly type of skin cancer, in an emotive and frank piece. A life-threatening disease thrust her into a state of shock, terror, and finally resilience. Come with us as we examine the significance of skin cancer awareness and early diagnosis through the lens of O'Donnell's moving tale. What happened when Norah was diagnosed with melanoma? Norah O'Donnell's life took a dramatic turn in 2016 after a routine checkup right before Thanksgiving. O'Donnell, who was 43 years old at the time, had been seeing a dermatologist for years, as most of us did. But this time, something worried her doctor, Dr. Elizabeth Hale. Dr. Hale chose to do a biopsy on O'Donnell after becoming concerned about 2 moles on her back. The news was terrible since it arrived when O'Donnell was in the middle of her holiday shopping. The biopsy had shown melanoma, so Dr. Hale phoned to let her know the news. O'Donnell remembers the scene clearly, horrified and crying. "I couldn't understand how this happened to me. I'm young. I live a healthy lifestyle," she confessed in an emotional interview with InStyle, her tears streaming down her cheeks. Dr. Hale reassured O'Donnell that the cancer could be treated, but that immediate treatment was necessary, despite the immense dread and uncertainty that she was experiencing. A substantial excision was performed during the journalist's surgical removal of the mole, which was necessary to eradicate all malignant cells. For O'Donnell and her loved ones, the ordeal was emotionally and physically exhausting. She had to do what no parent wants to do: explain everything to their young children. "In the days before surgery, I lay awake at night wondering if I'd be there for my kids' important life moments. Would I see their first dates or proms? It was a lot to process," recalled her. This diagnosis was a severe wake-up call because it brought home to her how short her life was. Even though she maintained a healthy lifestyle and went in for checkups often, O'Donnell knew she couldn't escape danger. It was a sobering epiphany that made her rethink her life's objectives and fight harder than ever for her health. Melanoma history. The most dangerous kind of skin cancer, melanoma, is the one that Norah O'Donnell was diagnosed with. It starts in the skin-coloring, pigment-producing cells, melanin. Although it is less prevalent than basal cell and squamous cell carcinomas, it poses a significantly greater threat due to its metastasis potential if not detected and treated promptly. Although it only makes up around 1% of skin malignancies, melanoma is responsible for the vast majority of skin cancer deaths, as reported by the American Cancer Society. Over 97,000 new cases of melanomas will be reported in the U.S. in 2023, with roughly 8,000 individuals losing their lives to the cancer. There are a number of things that might make someone more likely to have melanoma. Among these include a weaker immune system, a history of sunburns, a light complexion, a lot of moles or odd moles, a family history of melanoma, and too much sun exposure or tanning beds. Knowing that early detection is crucial is one of the most significant things to keep in mind with melanoma. Melanoma has a 99% 5-year survival rate when detected and treated early. As the cancer progresses, though, that figure plummets sharply. This is why it's important to examine your skin often and to see a dermatologist at least once a year. The ABCDE indications of melanoma should always be kept in mind while inspecting the skin. An uneven distribution of mass, with one half of the mole seeming different from the other. Encroachment. The periphery is not straight and smooth. Color. Brown, black, pink, red, white, and blue are all possible colors, and the color is not consistent. A pencil eraser's diameter would be an accurate description of the spot size. It's bigger than 6 millimeters. Changing. the mole's size, shape, or color is changing. The best way to lower your risk of melanoma is to avoid sun exposure altogether. Sunscreen with an SPF of 30 or more is essential, as is wearing protective clothes, staying out of the sun during peak hours, and never getting a tan in a tanning booth. Experiences with Norah's tanning bed. Although she now takes sun protection very seriously, Norah O'Donnell, like many young women, was not previously so careful. O'Donnell was an athlete and cheerleader who spent many hours in the sun as a child in Texas. The fact that she was a cheerleader and spent a lot of time outside in the sun as a child in San Antonio, she said in an interview with CBS This Morning. O'Donnell was at increased risk of melanoma due to more than simply the Texas sun. Before the risks were well recognized, O'Donnell used tanning beds often while she was in her 20s. In the 90s, we used to go tanning booths all the time, which, get the base tan or keep a tan in the winter, recalled her. O'Donnell feels overwhelming remorse for her tanning bed habits now. She is now cognizant of the fact that her chance of acquiring skin cancer was substantially raised with each session. The Skin Cancer Foundation reports that the risk of melanoma can be increased by 20% with just one indoor tanning session, and by almost another 2% with each successive session in the same year. O'Donnell is now speaking out against tanning beds, utilizing her position as a mother and public personality, particularly among young women. "I want to issue a warning to young people. Don't go to tanning salons," she insisted in a forceful on-air appeal. What O'Donnell went through is a sobering illustration of how our choices as children may affect us greatly as adults. An important lesson learned from her experience is the need to protect oneself from the sun and to dispel the notion of the healthy tan. Challenges during treatment and recovery. The fight against melanoma that Norah O'Donnell fought was a mental and emotional as well as a physical one. The required 6-week exercise break after her surgery was one of the most difficult parts of her treatment and recuperation. O'Donnell, who is a fitness devotee and ardent runner, found this time of forced idleness rather challenging. "Not being able to work out for 6 weeks was one of the hardest things. I was distraught," said the woman. After struggling with anxiety and sadness, the journalist realized how closely her mental and physical health were related. "I learnt the hard way the significance of taking care of oneself when one is sick or under stress, and it also served as a powerful reminder of the mind-body link. It also made me realize how much exercise is tied to mental health. I really was down in the dumps over the diagnosis, and then not being able to exercise had a big effect on my mood," said O'Donnell. O'Donnell had to deal with the emotional difficulties, but she also had to deal with the persistent worry that it might happen again. She now gets checked up regularly every 3 to 4 months to see whether there are any new or different moles since she survived melanoma. "I'm now in a high-risk category, so I have to be very vigilant," said the woman. O'Donnell, on the other hand, has decided to utilize her celebrity status to advocate for skin cancer screenings and early diagnosis. She goes public with her experience in the hopes that it would motivate people to take better care of their skin and not put off seeing a dermatologist. O'Donnell says she feels bad about how she handled her skin's health in the past when she thinks back on her own experience. In an interview with Health.com, she stated, "I think back now and I think, why didn't I go more frequently? Why didn't I take this seriously? Why did I blow off my appointment?" O'Donnell is really grateful that her doctor was vigilant enough to detect the melanoma early, even though she has many difficulties and regrets. She now knows that her result might have been quite different if Dr. Hale hadn't been so quick to notice and intervene. Importance of preventative screenings. Both Norah O'Donnell's personal life and her career as a journalist were profoundly affected by her melanoma diagnosis. Because of this, I am now deeply committed to promoting preventive health care and getting other people to make health checks a priority in their own lives. O'Donnell has become an outspoken advocate for the value of preventative health screenings and early identification since receiving her diagnosis. Despite the COVID-19 epidemic, she utilizes her position to encourage others to get preventive checkups immediately. In an interview with Healthline, O'Donnell made the observation that people delayed their preventative care as one of the things that occurred during the epidemic. People were afraid to go to the doctor or the hospital because they were worried about contracting COVID-19. Nevertheless, as O'Donnell notes, healthcare facilities have put in place rigorous safety measures to safeguard both employees and patients. One of my own doctors actually said a hospital is one of the safest places to be because there is universal mask and glove wearing, added the woman. Serious, even fatal outcomes can result from putting off preventive care, the journalist stresses. I think it's so important that we continue to get our preventative screenings, whether it's a colonoscopy, a mammogram, a pap smear, or a skin check, said the doctor. People's lives are saved when cancer is detected early, according to O'Donnell. Our greatest chance of a good outcome is increased if we can detect possible health problems early when they are most curable. This is especially the case when discussing skin cancer. There is a 99% 5-year survival rate for melanoma when it is found and treated early. O'Donnell says that all preventive screenings, not just skin checks, should be top priorities. She gets that it's easy to neglect our health among the chaos of daily life. Still, she stresses the importance of regular checkups, saying that they are investments in our health that should not be taken lightly. We have to make our health a priority. We have to carve out that time and make sure we're getting these regular screenings, said the doctor. It's not just about going to the doctor when something is wrong. It's about going to the doctor to prevent something from going wrong. O'Donnell's activism serves as a potent reminder that among the most crucial things we can do for our family and ourselves is to take charge of our health. Her tale highlights the universality of health concerns, but also the power of being proactive and watchful in enhancing our chances of early detection and optimal care. The results. How Norah's story will affect others. The choice to publicly document Norah O'Donnell's battle with cancer has had an enormous influence that goes well beyond her own life, inspiring numerous others to prioritize preventative care and take ownership of their skin health. Her story has become a catalyst for change. Dermatologists nationwide saw a dramatic increase in people requesting skin cancer testing after O'Donnell's disclosure. The account told by O'Donnell was the deciding factor for many of these people to seek medical attention. This is called the celebrity effect, and it shows how influential famous people can be when it comes to people's health habits. Raising screening rates is only one area where O'Donnell has had an impression. Sun protection, tanning beds, and early identification have all been major topics of discussion because, to her experience, many people have had these conversations in their living rooms, in their physicians' offices, and even on Capitol Hill, where politicians have proposed laws to make indoor tanning more regulated and to increase education on how to prevent skin cancer. The topic of cancer and survivorship has become less taboo because to O'Donnell's candor regarding her personal experience. She has put a name and a voice to a condition that impacts millions of Americans annually by recounting her fears, struggles, and eventual victory. Innumerable others who have been through cancer have found solace, optimism, and community in her tale. That cancer has no bounds is perhaps the most crucial lesson that O'Donnell's story has taught us. It has no respect for age, gender, ethnicity, or socioeconomic level. It may strike anybody. Sharing her experience, O'Donnell has inspired others to speak out, get care, and fight for their own health, breaking down the stigma and quiet that typically accompany cancer diagnoses. Promoting health through the work of famous people. A melanoma survivor and advocate like Norah O'Donnell shows how influential public personalities can be in changing people's views and actions about health. Famous persons and famous figures may influence millions of people when they freely discuss their struggles with health. One reason for this impact is that people tend to look up to prominent celebrities as credible and approachable sources of knowledge. An honest and well-respected journalist's narrative, like O'Donnell's, can have more of an effect than a one-size-fits-all public health message. Not to mention that famous people can help get others to pay attention to serious health problems that could otherwise go ignored. They may educate the public, debunk myths, and promote preventive health behaviors by utilizing their platforms to raise awareness. But there are perks and downsides to having famous people advocate for health issues. So's critical that famous people who bring attention to health concerns do so in a responsible and truthful way. They need to be aware of the power they have and make sure the information they offer is supported by evidence and checked by doctors. Also, famous people need to remember that their fans come from many walks of life and deal with a wide range of problems. Even if their experiences matter, they should be honest about the fact that not everyone is as fortunate as they are in terms of healthcare, resources, or social networks. A complex knowledge of the structural and systemic obstacles that could affect health outcomes is necessary for effective health advocacy. Notwithstanding these obstacles, there is tremendous room for famous people to make a difference in the health sector. They have the power to save lives by advocating for healthy behaviors, early identification, and preventative care through their platforms and voices. It is essential that we keep rallying behind famous people who have a positive impact in the healthcare industry as we go ahead. A future in which no one must confront a cancer diagnosis in solitude is within reach if we cultivate an environment of transparency, information sharing, and support for those affected by the disease. The strength of perseverance, the value of standing up for oneself, and the significance of preventive healthcare are all demonstrated by Norah O'Donnell's story as she battles cancer. The importance of skin cancer awareness and early diagnosis has been highlighted by her sincere and open recounting of her experience. O'Donnell's story highlights how anybody may get skin cancer, no matter how healthy they are and how active they are. But there is hope and inspiration in her narrative as well. O'Donnell had a good outcome from her early detection of melanoma, and she is now using her position to encourage people to be proactive about their health. While remembering O'Donnell's story, it's important to take stock of how far we've come in our fight against skin cancer. Research and technological advancements have improved patient outcomes by allowing for earlier identification and more effective therapies. On the other hand, we still have a long way to go before we can say that we've succeeded in getting the word out and that everyone can get the preventative care they require. By opening up about her experience, O'Donnell makes a strong case for why we should all make health a priority and schedule those necessary checkups. Regular screenings, such as skin checks, mammograms, and colonoscopies, can actually save lives. Managing our health isn't always a picnic, though. Time, energy, and at times conquering our personal fears and concerns are all necessary. The upsides, nevertheless, are much greater than the downsides, as O'Donnell's story shows. We can ensure a long and fruitful life for ourselves by taking charge of our health and making positive changes when we need to. Before we wrap up, I want to thank Norah O'Donnell for being so courageous and open with her tale. No doubt many people have been touched and inspired by her candor and openness. I pray that her story will motivate people to take charge of their health by demonstrating the power of perseverance and encouraging them to get screenings regularly. This investigation of Norah O'Donnell's inspiring battle with cancer would not have been possible without your presence. Like and subscribe to our channel if her story touched you. We have more motivational videos coming your way. Detection at an early stage can be life-saving. Make those reservations for the movies, and until we meet again, be good to each other and to yourself.